Good afternoon, it's Doc Kyle, and we're gonna talk about COVID this afternoon. So, in the immunology and serology department, we detect a lot of stuff in regards to COVID, like the antigen, the antibodies. No, we also detect neutralizing antibodies. But always remember that immunologic testing, though it's quite helpful and quite accurate, it is still subpar in detecting acute infections with comparison to your molecular diagnostics like your PCR, your nucleic acid amplification tests, no? So that is still the gold standard in detecting and diagnosing COVID-19. So, COVID 19 is the disease. Don't forget, COVID 19 is the disease, while the virus is your SARS-CoV 2. No? It is a beta coronavirus and it is enveloped, non segmented, positive sense RNA virus. Causes coronavirus disease 19. No? So, why is this 19? Because it was discovered in Wuhan, China, 2019. No? So, what makes the coronaviruses significantly unique in comparison to other viruses is because they have this spike protein that gives them a distinctive appearance like a corona or a crown. No? We also have our envelope. So your spike protein is very important because in most coronaviruses, it binds to receptors in the target target animal or target human. Um, it binds to the receptors in the cell so that the virus can go inside the cell. No? Because remember, viruses are intracellular pathogens. So that's where they grab and go in. Then we also have your RNA with your N protein. Remember that the nucleocapsid protein is in direct contact with your RNA, no, or RNA or DNA. That's why it's called nucleocapsid. They are the final defense of your genetic material of viruses, no. And then we also have our envelope, and then we have our hemagglutinin-esterase dimer. So the mode of transmission. So since coronavirus is a respiratory disease, it binds to your ACE2 receptors in the lung, no, via the spike protein, causing respiratory symptoms and fever, no, and other systemic symptoms. So, given that it comes from the lungs, its primary organ is of damage, is the lungs, meaning its primary way of transmission is through respiratory droplets. These droplets come from your mouth, no? Come from your mouth or your nose, your respiratory mucosa. These droplets are quite big, but they can be blocked by like 80 to 90% can be blocked by your masks, no? What are the proper masks? Your surgical three-ply mask, your double layered cloth mask, no? Your N95 respirators. So they're quite important, no? Because they block the virus coming out from the infected person's mouth. That is the purpose of the mask, no? So that if you are an asymptomatic carrier, you won't infect other people, meaning you are a considerate human being. People who don't wear masks for whatever reason, except that they don't have a mouth or a nose, are what we say inconsiderate people. Kumbaga, no, there is no such thing that you will not kanang if you have a problem with breathing in the first place that makes you not unable to wear a mask, whatever alibi you have, meaning it is already given that you are at high risk for COVID. Kung gihubak ka, first and foremost, I am asthmatic, but the maintenance medications for asthma is both readily available in number one in the health center, in our hospitals, no? And if you can afford, you can buy it in your local pharmacies. If you have poorly controlled asthma, number one, you are already at risk for getting COVID, and number two, getting a more severe type of COVID infection, no? So kung rasunan ko nimo ana, then you yourself are an inconsiderate person, and number two, you don't take care of yourself very well because medications for controlling asthma are readily available. And if you have controlled your asthma, then you can wear a mask, no? You can't reason out namang lisod ka ginhawa, no? So number two, people with allergic rhinitis. It is the same case with your asthma, no? There is ready supply in the health centers, in the hospitals, public and private for maintenance medications. Kung dili nimo na, if you're gonna say na dili ka ka-afford, I also don't believe you because we have lot of programs that will aid in getting you. It's just that you don't prioritize it, no? So if you have allergic rhinitis, same. Allergic rhinitis and asthma more or less have the same principle, no? They are a hypersensitive reaction. They share a hypersensitivity type of reaction in your airways, no? Making it secrete more mucus and making it tighter, you know? So that's why you have a hard time breathing. Even though there are a lot of inflammation going on in your airways, if you have asthma and allergic rhinitis, it doesn't mean that it will help against COVID. No, it rather it makes you more susceptible because there is less clearance of the mucus, kumbaga, no, and then there is less clearance, and then there is poor airway, there is poor exchange, so you are a prime candidate for getting COVID. Even though recent studies show that there is no clear risk between COVID and asthma, trust me, um, you don't want to risk it because given that it's it's not our it's not saying na given the data sa US man to pud, that there is no clear correlation. The thing is, in the US, most of their patients with asthma have controller medication. It's just as simple as that, no? But here, in our setting, controller medication isn't as popular, no? Even though you can get it, no? So, I think the research is, I think that journal is more tailor-made for the American population, not for the Philippines, no, because we don't know. But like I said, having a respiratory disease is already somewhat a risk factor to getting a COVID and getting a worse type of COVID. Number two, the more common people I see not wearing or improperly wearing our masks are the one who have a bigger BMI, the obese patients. So also remember that having a higher BMI not only increases your risk of having COVID, but also gives you a higher risk of having a markedly more severe type of COVID, no? Even the morbidity is higher in obese patients, no? So, like I said, no. So if you have a hard time breathing without COVID, no, with your normal, all the more that you should protect your airways. I'm not saying the best way not to have COVID is to not be exposed to people at all, social distancing, because humans are reservoirs, no, for this COVID virus, especially for kanang infected people, no. So social distancing, how can you get infected if you don't see other people, no? So that's why you really need to avoid heavily populated areas and closed off na mga areas with poor circulation. It's really hard for me to tell you this given that COVID is already ongoing for 2 years na. No? So, kato. So, current knowledge suggests that virus spreads between people who are in close contact, typically 1 meter. And a person can be infected when aerosol or droplets come into contact with eyes, nose, or mouth. I saw a journal that COVID going through the eyes is quite might cause conjunctivitis, but it passing through the ano into the respiratory system is quite rare. No, it's quite rare. So the virus can also spread in poorly ventilated or crowded indoor settings, no, where people tend to spend longer periods of time. So this is what happened to me when I got COVID because I had a co-worker who wasn't wearing a mask niya, ubo-ubo na siya, and then we work in the laboratory ba, and even though maski unsang ka ng maski unsang um, gani tawag ana kanang ginasita na nimo siya gahi gihapog ulo, so that goes into ano gihapon, goes into consideration that there are really people who are inconsiderate, no, even though you sita them though. But thankfully, praise God na wala man pud ko nag severe. I also had a good time in in my isolation center, so praise God for the Davao City response for kanang COVID patients. But overall, it would have been avoided given that if only people will follow protocols that are aimed with kanang consideration to other people, no. Let's just not be selfish, guys. It's just as simple as that, no. If you want to die, then you could then go. No, if you want to make poor decisions, then try your best not to bring other people with you, no, because I've seen what COVID can do to old people. I've seen what COVID can do to dialysis patients. No, it's really not nice. No, and to think your dinner out could wait. No, your coffee shop laag-laag could wait. No, no. So what's so hard about that? No, kanang dili ka magsuot og mask kay init, kalimuot. I mean, I don't know, especially when the people or the people breaking the protocols are medical medically inclined people. So it's quite frustrating. It's already 2 years and you should know protocols by heart. Yeah. So, ang worst pa kaya mga people who are in the higher official, no, higher officials. So anyway, kamo since students pa mo, I want you to follow even the basic lang yun, no? Wear a mask, socially distance, kana raman jud na. Because nothing will be, I don't know ha, if given the state of technology that we have right now, kanang we can connect anytime, anywhere. Of course, lahi man jud ang face to face and physical na jud, no. But are you willing to risk it, no? If you can, then you really should have to live with the consequences no matter what happens, no? It's just a simple mindset of consideration. So next slide. So important structures, no? The nucleocapsid protein. So it is bound to the genome to make up the nucleocapsid. Like I said earlier, RNA plus your nucleocapsid, no? So kato, your spike protein, critical for binding host cell receptors like in the lungs, the ACE2 receptors. Envelope protein interacts with M to form viral envelope, and then your membrane protein, the central organizer and assembly. Always remember these structures because that's what we detect, no? That's what we detect antibodies against. That's what we detect for your tests for diagnosis, no? So next is your kanin symptoms. So shortness of breath, diarrhea, sneeze, fever, chills, no? So what happens in COVID? That's why you get this actually it's just a simple viral infection. And not simple in a sense that its pattern is similar to other viral infections. What happens? What's so special about COVID is that the immune system reacts differently to it. No, sometimes it overreacts. That's why you get your severe COVID. No, so what we have is what we call a cytokine storm, meaning there is an overabundance of inflammatory mediators leading to kato severe ARDS, acute respiratory distress syndrome, mga ana, leading to myositis. So it's just a mixture of these multiple reactions, no? But for the most part, most people who get COVID only get the mild condition, no? So even me, I only had fever, not even chills, and cough, no? And fatigue. I didn't lose my taste or my smell, and it has sore throat. The thing that's very hard with COVID is that the symptoms are very variable. In SARS, in SARS-CoV-1, no first SARS, patients usually die when they get it. That's why it's really hard to spread it, because patients who live, patients who got it, they usually tend to be critical, no? So, ma-isolate lang dito. Unlike with COVID, there are people who have asymptomatic or mild lang na symptoms. And given that they're just mild or asymptomatic, they can still walk around, they can still pass on the virus to other people. That's why this 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 virus is very kanang contagious because of its variable na variable na symptomatology. The thing is, it's just ito lagi, it's quite very severe for those people who are at risk, the elderly, the ones with diabetes, hypertension, no? Those with respiratory diseases to begin with. So it's quite hard, no? So molecules to be detected immunologically. So the antigen test kit is quite a godsend, ba, no? So it's really a beautiful test, kumbaga, no? Because it's quite specific and sensitive, especially the first day of symptoms to the third day. No, you can really prove that you're COVID positive. But the thing is, the antigen test is still not the definitive test. It's still not the gold standard. So even if you're positive with the antigen test, you really need to undergo a PCR test to definitively diagnose if the patient is a COVID patient. No, so the antigen test detects the nucleocapsid protein. Remember this nucleocapsid protein because this is a recurring theme. So in your molecular biology, your PCR, what we detect is multiple proteins, but the nucleocapsid protein is the most specific to SARS-CoV because other coronaviruses have similar antigens, no, similar proteins. So, but this type of nucleocapsid protein of the COVID, no, of SARS-CoV-2 is very specific to itself, no. It doesn't have any overlapping similarities to the other coronavirus, unlike your envelope protein, which has similarities to other coronaviruses. So the nucleocapsid protein is the most um, consistently the most specific for SARS-CoV-2. So for your antibody, so when we detect the antigen, we detect the presence of the virus. But if we detect the antibody, we detect the response of the body against the virus, no? So we detect non-specific antibodies for your qualitative in examination, which is quite personally useless, no? It's useless in a sense that, in a diagnostic sense, that it really doesn't give any much information, because if you detect antibodies, for the most part, the disease is already run its course, no? There's no, the reason why we need to detect the if the patient is COVID positive, no, either antigenically or via PCR, is to so that we can isolate the patient, so that the patient will never, I will not infect other people. But if we detect antibody, if we rely on antibodies for detection, whether if we call the patient COVID positive or not, it might be too late na. No, so meaning, because even if the patient is symptomatic right now, coughing na siya and fever, and then we took an antibody test, there is no clear assurance that it will become positive with IgG or rather IgM or IgG, no, because it takes time for the body to produce antibodies, no. So it's quite useless. So even if mag-negative siya, and then negative man din yung antibody test, lako-lakaw sa dito, then we already defeated the purpose of this screening. So it is more useful for mass population, no? Example, isa ka barangay, and we're gonna check if na-infect na ba ni sila. It's a past, no? It's more of a retrospective na look if they already had COVID. So, and it's easy lang man god. We just need whole blood. We need to prick their fingers, and then we check, nagka-COVID na sila, kaya na sila yung mga COVID IgG na antibodies, no? IgG is the long-lasting, the permanent, no? And then IgM is your acute phase na antibodies, no? So if they kita ni mo, IgG, so they probably had COVID long time ago. And then it's a test kit, so you can have a large sample size and you can get the results within the day. It's more for research rather than diagnostics. So this one, the neutralizing antibodies for quantitative examination, this is the more helpful one. So what are neutralizing antibodies? There are multiple types of antibodies. You have your complement fixating type, your IgMs, no? There is also complement fixating type na IgG. There is also stimulating na IgG, no? But what's important in the context of COVID is your neutralizing antibodies. So meaning these neutralizing antibodies were as research, no? They block your spike protein from binding to your ACE2 receptors, no? That's why that protects you from having the disease, no? Because the COVID virus cannot go into your respiratory cells, no? So that's why they are called neutralizing, because they neutralize the action of the COVID virus, no? So this is more important because if we can say that you have a lot of neutralizing antibodies, meaning you might be protected, no? But that's not in the entire story, ha. So if you have a small amount of neutralizing antibodies, then more or less you're not protected. So we can correlate this with example booster shots or having a vaccine in general. So if you have um kanang if you have very low neutralizing antibodies, then you might be it would be nice for you to have a vaccine, no. And if you already had the vaccine, no, in the case of example well-known vaccines, they tend to wane, meaning your neutralizing antibodies post vaccination, they tend to wane over time, no. So we have a journal about certain vaccine, it only lasts for 6 months, which is of course more or less I believe it, no, because most of the breakout infections, no, breakthrough infections for post vaccinated post vaccinated people are within that 6 month period after vaccination, no. So kato, so it's good to monitor. Even though you're vaccinated, you need to monitor your antibodies if they're lower na. So it would be nice to have another booster shot, no. For me personally, after I had my COVID, I monitored my neutralizing antibodies, no. They were very high. The machine can't give me a definitive number because they were at the max max quantity, no. So even though I am a candidate for a booster shot, given that I am kanang my time, the interval between my initial vaccination and the current now is more or less I'm more greater than 6 months already, which is the advised, no, the recommended period for your booster shot. I opted to wait it out because there are still no guidelines paman good on post-COVID patients having booster shots. No, the recommendation is just after 6 months from your initial, but there are many circumstances that will be considered pa. So and I checked continuous antibody tests na quantitative. The result still is very high, so I would I would like to check it maybe before the year ends or next year in January if it goes down. So then I might consider having a booster. But the thing with this neutralizing antibodies, no, and the quantitative examination for antibodies against COVID is we still don't have a clear cut off what is very protective. Sorry, what is a protective value, no. So it is still a case to case basis, no. So by theory, the more antibodies you have, the more protection, the more neutralizing antibodies you have, the more protection it should afford you. But as we all know, as COVID has time and time reminded us, in biology and in life in general, there is no such thing as kanang constant, no, or there is no such thing as too familiar with the knowledge, no. So there's always something new. For me personally, I would like to wait it out for maybe next this December or next year, or until guidelines or researches or journals have been published, which I have read. No, I'm not saying I'm against booster vaccines. I'm all for it. No, especially if you had your 6 months na after 6 months na vaccination, and then If you didn't have COVID, you know your titer, I'm all for it, then go, no? But for me personally, I want to check sa, no? I'm not afraid of any kanang reactions because reactions are very poor. I kanang rare. It's just that it's somewhat an experiment for me pud also, no? So kato, remember that neutralizing antibodies are the ones that bind to your spike protein, no? From binding, they block the spike protein from attaching to your ACE2 receptors. No? So this is your qualitative antigen test. It's really a godsend, no? Thank you, Lord, for the antigen. Because number one, it's quite cheaper than your PCR. And number two, it's faster. Though its sensitivity, no, is it's quite sensitive and specific. It's just that it only detects one protein. It's which is your nucleocapsid protein. So kato no, so what happens is it's the same with the with other immunodiffusion ng mga kits, no? It just depends on the test kit, no? So you add here in the sample well, there is already antibody with ano detector molecule. Most commonly is colloidal gold, no? And then once you add the blood here, the green is the antigen, which is your blood. No, sorry, not your blood eye, your nasopharyngeal swab na with a VTL, viral transport media, VTM, and then you add a buffer and then you drop it there. Muna siya. Muna to yung solution, your nasopharyngeal swab juice with your NSS or buffer. It will go into the sample well. It will bind, if the antigen is positive, it will bind to this one, antibody against the antigen, and then it will run through due to capillary motion and no. So it will bind to your there in the first line in your test line. There is also an antibody fixed against the antigen. So what will happen is magdikit tong sa antibody with the detector molecule and magdikit siya sa antigen, and then as nagaanod sila, the fixed antibody against antigen will also bind to the antigen. So it will trap the antigen, and it will trap the antibody with detector along with it, no? So magline siya dito. So here, magline siya din here if it's positive. And then what we have here is we have a control antibody. Your control antibody is just an antibody against another antibody. So it will always bind the antibody with the detector. That's why it's called a control. It will always bind. It needs to be present, no? If the control is not present, then it is an invalid test, no? So So if you're gonna ask, ngano mag-positive man gihapon ng control if nag-bind na siya sa antigen? Because they make it a point that your test kit, there is really an abundance of the antibody with the detector, so that makaabot jud siya even though masangit siya din sa test no, mag-positive siya, there is still enough for that control to be positive. Goods, no? So this is a specimen collection, no? So medtechs do this in an ideal world. So that's how you get the specimen or nasopharyngeal swab. Dasok siya sa ilong, pack, no? So first step, no? So the first step is you need to act like gihuldapan ka. No? Na siya, hold hands up, no? But no, so it's really important that you have proper PPE when doing this because you'll be exposed to droplets, no? So it's very important that you have a respirator. Your respirator is just a mask that's very tightly fit, no? And it can absorb. The meaning of your N95 is non-oil, meaning it can't filter out oil. It can only filter out water-based ng mga droplets. 95%, 0.3 micron, no? 0.3 ba or 0.5? Basta I'll correct myself lang that. No, so it can filter that out, no? So kato slightly offset from the patient if it's right-handed, then stand to the left of the patient, tilt the head about 70 degrees, 70 batok degrees. Yeah, tilt the head and then grasp the swab like a pencil, and then pasok sa end of the shaft, no? Place the swab at the bottom of the nostril, dili pasok ka, bottom of the nostril, and then kato. So, what happens is, after you do that swab, no, it's a collection. It's a thing that you need to know now in this modern time, no? Because as if you're gonna graduate, I'm pretty sure COVID is still there after you guys graduate, no? It will not leave us. It will become, hopefully, a milder form. Hopefully, dili na grabe ang COVID by the time na mag-graduate mo. But I'm pretty sure it's still there. Unless there is a huge meteorite which will wipe us all out, no? So, kato. So, it's a skill that you really need to learn. So, kato. Don't be shocked if sometimes there will be blood, especially with patients with allergic rhinitis, meaning their nasal airways are quite thick and fragile. So, na jud time na magdugo jud siya, no? So, di lang ta mag-worry, ana. Next, so this is what we do for your qualitative antibody detection. So, your qualitative antibody detection is you just need whole blood, skin prick, butang sa test kit, no? And then kato. So, what happens? So, like I said earlier, your antibodies get present in the blood quite late. So, here, I'll look at this table before symptom onset. You're already positive, no? Here. Positive molecular ka. Here is the earliest. And then your molecular is the first one to, your RNA is the first one to increase. That is detected by your molecular studies, your PCR or your nucleotide amplification test. And then this one is your antigen, which is, at the same time, it will increase as your RNA, but it's quite slower. So that's why your antigen test is very helpful, especially in places na walay PCR. So, example, you have a patient, you are in a bukid, no? And then you think that the patient clinically has COVID, nag-ubosipon filanat na siya, no? So, you take an antigen test, so the patient is already positive, even though there is still no definitive diagnosis na COVID siya because wala pa siya na PCR, you can already start to isolate the patient, no? So, kato. And then, look at this, the IgM antibodies, even though they are the first to increase, no, contrast to your IgG antibodies, they take a long time pa, still after a week pa from your infection, your exposure. So, dugay pa siya, no? So, this is your exposure, and this is where you're becoming symptomatic na. Over here, week 1 sa imo symptoms. No? So, look at the antigen. Even before symptomatic ka, nag-positive na siya. No, that's why it's very helpful for the antigen. No? But, then again, PCR gihapon ang gold standard. So, for the qualitative antibody detection, use whole blood, skin prick, plasma, or serum. So, unsa ba ang gina-detect naton antibody? It's just non-specific antibody lang jud. We don't know if it's a neutralizing type of antibody. We don't know if it's neutralizing it's a complement activating antibody, no, or stimulating antibody. We don't know. It's just a non-specific antibody for your qualitative antibody detection. That's why it's not very helpful, no. But so kato, your nasal swab. So positive imuhang nasal swab ang imuhang PCR. So IgM or IgG, meaning maybe dili pa siya symptomatic, window period before magawas ang symptoms. And then we have your positive and IgM, early stage. PCR positive, both positive in the active phase, and then PCR, and then late or recurrent stage. No, so remember your RT-PCR. It takes a while before you get negative with your RT-PCR, no, because there is still viral fragments in your nose, no, and in your oropharynx, to that matter. That it will be still shed for a while, but given that if you are positive your RT-PCR, you're not infectious anymore. That's why, based on the new guidelines, in both WHO, CDC, and DOH, you don't need to have an RT-PCR after you get infected by COVID. No, kanang mga nagapa RT-PCR after COVID infection, just to prove that they're negative, they are not following those guidelines. No, it is just the city's, the LGU's prerogative, which in fact I don't believe. No, because I believe that after 10 days, this has been researched time and time again now, that even after 10 days after your infection, given that you are no longer symptomatic for 3 days, no more cough, no more fever, no more other symptoms. Even if you have a mild cough, the cough is the last one to get resolved, because cough is not a specific symptom. It just simply means there is still irritation in the airways, in the lungs, in the airways, in the nose, even in the upper esophagus, no? So in the oropharynx, no? So it's not specific. There is just irritation, but it doesn't mean that you're still infectious. So based on the guidelines, 10 days from your PCR na positive test, given that you are no longer infectious, that is your WHO CDC guidelines, the DOH, that's gonna be 14 days, no? 14 days. And if you are severe, maybe 21 days. So if mild to asymptomatic, 14 days. Given that 3 days, wala na symptoms, that's your DOH, WHO, and CDC, is 10 days lang. So, kato, i-discharge na ka from the facility without any need for a discharge PCR. No? Wala siya. Because the PCR, for the most part, in the early days of COVID, natay mga patient na positive og PCR gyapon after 2 months. Even though symptomatic, they are well and good na. It is because there is still shedding of viral fragments in the nose, no? It doesn't mean it's a whole virion shedding. It's just that it just means that there are still some viral fragments in your nose. That doesn't mean you're infectious, no? So after 14 days, you are given that you are no more symptoms, then you are free to go with public. Given that you are still using social distancing, you are still observing social distancing, wearing a mask, no? So kato. So here, blood test na to, negative. Patient may have had a past infection that has recovered, and then both IgM and IgG may be false negative in your PCR. The PCR can still become false negative, especially if there is improper na collection. Most of the time, it is due to the medical technologies, no, or the collector mahadlok magswab og tarong, so wala na swab sa tumoy jud sa nasopharynx, ilong lang. But it's not that big of an issue man, a collection. It's more of the transport and the storage usually, no, because you need to have very cold storage manggod and specific viral transport media. If bati imong viral transport media and imuhang storage, then maybe ma-false negative, no? And if your reagents are expired, no? So, quantitative antibody examination. So, I'm also an advocate for quantitative antibody examination, even though we don't know the values that will protect you. It's just like you already have a gauge on what to expect, no? So, can detect neutralizing antibodies. So, these antibodies are the ones that usually bind to the spike receptor. Blocking of the spike receptor will make the virus incapable to bind the ACE2 receptors. Like I said earlier, can be done using ELISA and other immunologic methods. So, kato, detect siya via ELISA. Now, we detect the neutralizing antibodies. And prevention, social distancing, proper wearing of masks, and proper hygiene and vaccination. No, I think dali ramang kaayo na, no? So, kani is a very beautiful presentation. This is not petty, this is professional, no? Because it's true, no? It's wearing your face mask like this is really wearing your underwear like this, no? It kind of defeats the purpose of wearing a mask in the first place, no? So kato, especially ka nang naka-amigo and then, uy, mag-story mo, tanggal kag mask. Uy, bay, kamusta naman ka? So what's the point of wearing a mask kung every time you're gonna interact with another person, you're gonna take it off, no? It's another gripe I have with kanang eating in public places, no? Magmask mo padulong and then pag-abot na mukaon mo, no? Because eating is another factor. Eating together with people, time and time again, has proven that it is a kanang mode of transmission, no? Eating because you're chewing, you're opening your mouth, you're talking to other people, you're having a good time, you know. So of course, there's gonna be exchange of droplets, more or less. So if you have any questions, feel free to ask. You know where where to PM me. And thank you. Stay safe. If you have any questions regarding vaccination, COVID prevention, what to do when you have symptoms, just feel free to ask me. No. Thank you. Bye bye. God bless.